everyone, welcome to Pharmacy in Our Lives, a pharmacy show sponsored by Guehung Media and Pleasant Care Pharmacy, a locally owned health mart. My name is Dr. Chau Phan, the main host of the show. It's my pleasure to be here today to educate the public about different health topics through the perspective of a pharmacist. So sitting with me today is another co-host, and her name is Cynthia. Cynthia,
Hi.
welcome. So she is a first-year University of the Pacific pharmacy student, and I always like to bring new students come on, give them a chance to kind of get exposed to what it's like to be on a pharmacy show. So thank you for coming.
Yes, no problem.
So the goal of our show is to encourage viewers to be more aware of their health and wellness by educating on common health topics, drugs, and pharmacy-related topics. Many of the conditions that we will be discussing on the show are preventable and can be managed at home if everyone can understand how important it is to comply with treatment, which includes not only medications, but also lifestyle changes. So today we will be talking about dermatitis. So dermatitis means it's an inflammation of the skin. There are many different forms of dermatitis, but today we will only be discussing a few specific types, including atopic dermatitis, which is also called eczema, contact dermatitis, diaper rash, and seborrheic dermatitis. And we will be going over what they are as well as how to treat and prevent these forms of dermatitis.
Atopic dermatitis, also known as eczema, includes symptoms such as itching, small raised bumps that can leak fluid and crust over when scratched excessively, and red, leathery, cracked, scaly patches on the skin. Eczema often occurs at the hands, feet, ankles, and wrists, neck, upper chest, eyelids, and bend of the elbows and knees, and in infants at the face and scalp. It tends to flare periodically and clear up for a time, possibly even for several years. The cause of eczema is unknown, but there is a strong genetic link, meaning one is more likely to have eczema if someone in their family has had it. So some common problems associated with eczema include infection and poor sleep quality. Infections are more likely to occur due to broken skin from excessive scratching, making it easier for bacteria to invade the area. Sleep can also be disrupted due to itching and scratching at nighttime.
The treatment of eczema will depend on the severity of the disease. For mild eczema, use a low-potency corticosteroid cream or ointment such as Desanide 0.05% cream or hydrocortisone 2.5% cream or ointment, and apply the medication 1 or 2 times per day for 2 to 4 weeks. For moderate eczema, use a medium to high potency cream or ointment such as fluocinolone 0.025% ointment, triamcinolone 0.1% cream or ointment, or betamethasone dipropionate 0.05% cream, or the hydrophilic emollient or the ointment version. So you want to apply the medication 1 to 2 times per day for up to 2 weeks. Then you want to replace with a lower potency medication once your rash or your eczema has gotten better until the lesion resolves. Now, before applying the medication, you make sure you want to wash the affected area gently and pat it dry. You want to use the fingertip unit to measure doses. What we meant is from the top of the finger to the first fingertip. That's a fingertip unit to measure. 1 fingertip unit is the amount of topical steroid that is squeezed out along an adult's fingertip. The amount of fingertip units will depend on the area of the skin to be treated. For adults, the front and back of a hand and finger would require about 1 fingertip unit. So if you want to apply it on the front and back of your hand, that would take 1 fingertip unit. The front chest and abdomen would require about 7 fingertip units. The back and the buttocks would require also 7 fingertips units, and the face and neck would require 2.5 fingertips units. If you need to apply an entire arm and hand, that would require 4 fingertip units, and an entire leg and foot would require 8 fingertip units. When applying, make sure you want to apply a thin, even layer. This is important as it will reduce your risk of side effects such as thinning of the skin. This thinning of the skin can make it easier for your skin to break, bruise, or even stretch. Another common side effect associated with corticosteroids is a mild burning or stinging sensation when you first apply the medication. This will usually go away after the first few uses. So it is very important to follow the doctor's instruction on how and when to use the medication. Only use the medication for as long as the doctor tells you to, as corticosteroids should not be used long-term as they may increase the risk of more serious side effects. So now let's take a look at how we can prevent eczema.
So here are a few things that you can do to prevent eczema. Keep your skin moisturized with lotions, creams, or ointments. Identify triggers and worsening the condition and avoid them. Some possible triggers include sweat, stress, soaps, obesity, dust, and pollen. Take shorter showers and don't use hot water. Use warm water instead. Use gentle soaps such as Cetaphil, as harsher soaps can remove more natural oils and dry the skin. Now that we've learned a little bit about eczema, let's learn about contact dermatitis. So contact dermatitis includes symptoms such as red rash, itching, dry, cracked, scaly skin, swelling, burning, tenderness, bumps, blisters, and sometimes oozing and crusting. Contact dermatitis usually occurs on areas of the body that have been exposed to the reaction-causing substance, leading to a disruption of the skin barrier. There are many substances that can cause the reaction, including soaps, cosmetics, fragrances, jewelry, plants, and more. It usually develops within minutes to hours of exposure and can last from 2 to 4 weeks.
The treatment for contact dermatitis is aiming at reducing the signs and symptoms of inflammation and restoring the skin barrier and will depend on the severity. For severe contact dermatitis with skin thickening, you want to get a super high potency topical steroid, which should be used such as betamethasone dipropionate augmented 0.05%, either in gel, lotion, or ointment form, or clobetasol propionate 0.05% cream, gel, or ointment form. Apply the medication thinly once or twice daily for 2 to 4 weeks. For milder forms of contact dermatitis, then use a high-potency corticosteroid should be used, such as ansinonide 0.1% ointment or fluocinonide 0.05% cream, gel, or ointment form. Apply the medication once or twice daily for 2 to 4 weeks. For acute or chronic contact dermatitis involving the face or flexural areas, that means like areas that have really thin skin, a medium or low potency topical corticosteroid should be used, such as desonide 0.05% ointment or gel, or triamcinolone 0.025% cream, lotion, or ointment. You want to apply these once or twice daily for 1 to 2 weeks. So flexural areas are parts of the body able to flex, such as the back of your knees, inside of armpits, elbow, and groin. These areas have really thin skin, so you don't want to use high potency corticosteroids. When you apply corticosteroids, wash the affected area gently and pat it dry again, just like I talked about earlier. Use a small amount of medication and apply a thin, evenly layer. This is important as it will also reduce your risk of side effects such as thinning of the skin. So another common side effect associated with corticosteroid is a mild burning or stinging sensation when you first apply the medication, and it does go away after the first few uses. So it's very important again for you to follow the doctor's directions and to discontinue when it's resolved.
So there are a few measures that you can take to prevent contact dermatitis, which include avoiding irritants and allergens, washing your skin as soon as you come in contact with the irritants, wearing a protective clothing or gloves when you're exposed to these things, and using barrier creams to cover the skin exposed to irritants. Examples of barrier creams include Improve, CeraVe, Cetaphil cream, and Vaseline. Now that you've learned about contact dermatitis, let's take a look at a more common skin condition for babies, diaper rashes.
A diaper rash is a skin rash that can occur in an area that is covered by the diaper. Symptoms may include red, painful, or itchy skin raised, peeling, or scaly areas, or yellow blisters filled with fluid. Diaper rashes may be caused by the urine or bowel movement in the diaper, which can irritate the baby's soft skin. It can also be caused by perfumes or dyes in a diaper that a baby is allergic to, or skin conditions or infections that happen in the diaper area but are not caused by wearing a diaper.
So in order to treat a diaper rash, you should follow these steps. First, take the diaper off to air out the skin as much as possible. 2, check your baby's diaper every 2 to 3 hours and change when it is wet. 3, change your baby's diaper right after each bowel movement. 4, gently clean the area covered by the diaper using warm water and a soft cloth or with a mild and unscented soap, and then pat the area dry with a soft towel. 5, lastly, you should use a skin ointment or paste on the area each time you change the diaper. So use a product that has zinc oxide or petroleum in it, such as Desitin, triple paste, A&D ointment, Balmex, or an inexpensive option would be Vaseline. Products with these 2 ingredients in it form a protective skin barrier against the wetness, making it feel ideal for diaper rashes.
To help prevent your baby from getting a diaper rash, there are a few things that you can do. You should change your baby's diaper often and clean the diaper area gently using warm water and a soft cloth. Be sure to use unscented baby wipes without alcohol and use a diaper ointment or paste on the area each time you change the diaper. Now that we've learned about diaper rashes and how to treat it, let's take a look into seborrheic dermatitis of the scalp of the babies.
So seborrheic dermatitis is a common skin condition that mainly affects your scalp. It can occur in both infants and adults and is seen more often in men than women. Seborrheic dermatitis is a chronic condition often seen with relapses.
The treatment of seborrheic dermatitis of the scalp will depend on the severity of the disease. For mild cases, that is those without inflammation, then you have dandruff. So you can use an antifungal shampoo to treat those mild cases. An example would be a drug called ketoconazole 2%, or a brand name is Nizoral AD, or you can use cyclopirox 1%, zinc pyrithione 1%, or you can buy it over the counter. It's called Head and Shoulders, or Selsun Blue, which the active ingredient is selenium sulfide 2.5%. You want to apply 5 to 10 ml of these shampoo and leave it on for 3 to 5 minutes before rinsing it off. For ketoconazole, it is recommended to use twice a week for 2 to 4 weeks. For the cyclopirox, it is recommended to use twice a week for 4 weeks as well. There are minor side effects such as irritation and or burning sensation are common with these antifungal shampoos. For moderate to severe cases, that is those who have scaly, inflammation, and itchiness, a combination of an antifungal with a high-potency corticosteroid is recommended. An example would be an antifungal that is a ketoconazole 2% with clobetasol, which is a corticosteroid 0.05% solution. You can also use salicylic acid shampoo to add to this regimen with those that have really thick, scaly dandruff.
Now that we have seen how to treat seborrheic dermatitis of the scalp, there are a few additional measures that you can take in order to control it. So if a shampoo appears to no longer be effective, try different shampoos and rotate them, as they may be some fungal strains that can become resistant to antifungals. So also another tip is to soften and remove the scales from your hair by applying mineral oil or olive oil to the scalp and leave it on for an hour or so. Then comb your hair and wash it. Another tip would be avoid styling products while you are treating the condition. And lastly, avoid hair products that contain alcohol, as these can cause flare-ups.
Thank you so much for watching Pharmacy in Our Lives, brought to you by Guehung Media and Pleasant Care Pharmacy, a locally owned Health Mart pharmacy. We hope you find the information today very useful. Dermatitis is very common topic. So I think that for you to understand and how to treat it, and they're not hard to treat as long as you understand how and when to use what, that would really come in handy for you. And I want to thank Cynthia today for coming. I hope it wasn't too stressful or too nervous. So she got really, more comfortable as we go along. So thank you for coming today, okay? If you have any questions or suggestions, please email me at chau.phan@pleasantcarepharmacy.com or call us at 510-200-9984. We have pharmacists and pharmacy student from UOP to help answer your questions free of charge. You can also visit me at www.pleasantcarepharmacy.com. Thanks again for watching, and we'll see you next time. My son, at 3-month-old, he had really bad eczema. It was all over his face, his body. Sometimes at night, he would wake up and cry, and we would find him covered in blood from scratching himself. I took him to his primary care physician, an allergist, even a dermatologist, even trying naturopathic doctor. And through all those, most of the Western doctors, they prescribed to him steroid cream. And being a pharmacist, I know that steroid cream long term is not good for my son, so I don't want that to be his treatment forever. I tried really hard finding a solution for my son, and I couldn't find anything that really helps him and maintain his eczema. So when I was able to open up my own compounding pharmacy where I can create creams and come up with formulas myself, then I said, well, that's the first thing that I'm going to do. I'm going to try to find an alternative cream that doesn't have long-term side effects that my son can use for a long time every day. So my cream, after I use it on him, he has now improved up to 90–95%. With that in mind, I wanted to help other people that have skin disease and skin problems that just couldn't find that solution.
My acne was very, very bad. It appeared all over my face, my cheek area, my neck, all the way to my back and my shoulders.
Every person, their skin needs are going to be different. So that's why I want to sit down with the patient and find out their problems or what they're looking for, and come up with a formula that are specific for their skincare needs.
Chau gives you that special care where she'll sit down and spend the time to discover what your needs are and what you want to look like, and give you the product that's appropriate for your skincare.
I believe that one size does not fit all, and it shouldn't fit all. There are a lot of brands and there are a lot of products out there. So for me, I believe in simplicity and cost effectiveness.
I have to use at least 5 products per night for my regimen. This is what I got from Pleasant Skincare. There's only one product that I have used to achieve the result I wanted.
I can customize whatever you need into one bottle, and it not only decrease on the amount of products you have to buy, but it also decrease on the amount of money that you have to spend. And it will decrease on the amount of time that you have to spend on your face and your skincare regimen.
I've been using Pleasant Care pharmacy products for about a year, and definitely seen the difference.
I like Mommy's cream so much.